So my name is Nanami Mano. I'm a geriatric physical therapy resident at University of Pittsburgh Medical Center, Centers for Rehab Services, and it's located in Pittsburgh, Pennsylvania. So I chose to become a physical therapist. My first encounter in the field was when I was in high school. I was doing like observations, and we had a career opportunity during one of our classes where we could observe another professional. And I first started to look into like emergency medicine. I was interested in healthcare, but the physician told me that try like maybe this is not something you want to go into. It's really difficult. It's like the work-life balance is hard. So that kind of deterred me away from that. But I was introduced to physical therapy in the inpatient rehab department, and my interactions it was mostly with older adult patients. So from there, I just love the idea of like the holistic, like non-pharmacological like approach, and that how physical therapy is all movement focused, and that is the way people can be like we can improve their function so they can get back to what they enjoy doing. It's not the fastest process, but the journey that the patients go through and the time spent getting to know the patients and learning from each patient was very rewarding to me. So since high school, I wanted to do it all through college, and then getting into PT school, I decided to go into geriatrics because during my college years, my grandmother was battling Parkinson's, and she also had a stroke during that time as well, and she was declining and went through physical therapy herself, but she was living in Japan. So I also was able to visit her and get to observe like physical therapists in another country and how they treat it, and just like the differences, especially because in Japan, the geriatric population is growing exponentially much more than it is here. So I got to see like both sides of things and got interested in potentially working internationally just for Japan and United States to improve the care for the geriatric population. I went to Slippery Rock University of Pennsylvania. That is located in Slippery Rock, Pennsylvania. And I graduated last May, so May of 2021. I've been a physical therapist for 9 months. It's crazy to think that because it hasn't been even a year, and I've learned so much in the residency program. But I went straight from PT school to doing the residency program, and I decided to do a residency program. I didn't really figure out that I wanted to do one until my second year of PT school. One of my professors was a geriatric specialist, and she kind of talked me into it. I took her geriatrics course, and she introduced me to it. I got to talk to the faculty member at UPMC, and I really like the fact that, especially for UPMC's program, I could experience all the settings. So home health, skilled nursing facility, acute care, inpatient rehab, and also outpatient. And I wanted to feel more confident in being able to evaluate and treat older adults in all those settings, and also have like a strong group of mentors who are geriatric specialists, because there is not enough geriatric specialists out there that I would have to like go out of my way to find people that I could be mentored by if I didn't go through the residency. So that was my main factor. I wanted like the structured one-on-one direct mentorship right after PT school, so I can get that, so I can be better at what I can do and help me grow early on in my career. So there are three main things. Teaching was a big factor. I wanted to teach in the future, so the program has teaching opportunities where I can teach at University of Pittsburgh. That was a big factor. And there aren't many geriatric residencies out there and across the country. let alone the ones that are like partnered with a university. So that's something that I looked into. Um, and for at least my program, it's not only DPT students, but we get to also teach in different avenues, like being able to teach other geriatric clinicians, so pharmacists, medical residents and fellows, and also other geriatric clinicians, and also doing community outreach presentations. So also going out to the community and talking to older adults. Um, Another thing that I looked into was the mentorship structure. So I know some programs are different in how they offer mentorship, but at least for the program that I'm in, we do have direct one-on-one mentoring, and we do so one-on-one direct mentoring while I'm doing patient care. That's what I have majority of the time, but I also do have some that are outside of patient care that I get to talk to my mentors and go through certain topics that I might be like interested in learning more about. And then also another thing that I wanted to look into really was the mentors of the program and also the program directors and how supportive they are. And especially the mentors and directors in my program, they really cared about our well-being and mental health. So they definitely acknowledge burnout, which can be a problem within our field. And because residency is such a demanding program and commitment, that was something that was important to me. Yeah, I can definitely go into a little more about like the unique side of things because there are a little more. We do have something called geriatric medical core curriculum. That is where we get together with like the residents, medical residents, the fellows, pharmacy residents, and pharmacists, geriatric clinicians, and we have week-to-week meetings where we listen to presentations given by each other and learn about different disciplines. So it's a big interprofessional collaboration, which I really like. And we also have something called specialty practice observations, where we get to not only be in the clinic and do also the didactic portion, but also observe different clinicians. Like we got to observe a palliative care team and learned about hospice care. I got to follow like a physician, social worker, and a physician assistant who are specialized in palliative care, and also like a low vision occupational therapist, and got to see driver's rehab tailored towards the older adult population. So that is very neat. I don't think most residents offer that, so that's something that I really liked and enjoy so far. And then teaching has been my number one part that I've enjoyed. I really like being around students and getting to provide the knowledge and also learn more about them as well. The biggest challenge was because we are still in a pandemic, there's been a lot of shortage of like nursing staff, also therapist staff. So adjusting to staff shortages for each of my rotations has been a little difficult. And also being in a rotation that I realized that wasn't for me, that might not be my favorite, and don't see myself being in that setting. It's been hard to kind of grind through and power through it, but it's been a good learning opportunity. So I would say my number one advice is to really think about why you want to do a residency and what you mainly want to get out of the residency program, and thinking about what you want to do with that knowledge and going through that program 5 years down the line, 10 years down the line. And I say this because if the sole reason of why someone might be wanting to do a residency is to just get credentials, get some letters after your name, you can do that another way. You can specialize by getting the 2,000 hours of working in whatever like specialty that you want to get into and sit for the board exam. And also picking a program based on your needs and the goals that you have. Some qualities that I would say that would be good for that would be that would make someone successful for a residency is someone whose willingness to receive feedback and be able to implement them. Anyone that can soak in every opportunity and learning moment like just like a sponge. Um, Another thing, to be more adaptable to change, especially if your residency program has multiple rotations like mine. Um, you have to learn new documentation systems, the facilities, and getting used to the coworkers that you might change, you might get used to in one setting, and then having to move to the next one can be a challenge. So being able to adapt to change. Just a little bit of background. I was involved in uh, for during PT school. I was involved in research, being in the pro bono clinic. I was also on the APTA, Student Assembly Board of Directors, and I even worked as a TA and also a rehab aide. So doing all the extracurriculars, it really helped me with my time management skills, and helped me get out of my comfort zone. I learned about my weaknesses and strengths, and I was also able to gain communication skills, like speaking with presentations and also writing, and being able to educate and deliver content to different types of audiences is something unique, and that's something I want to be able to be better at when I'm talking to like clinicians, patients, and students. So that helped me a lot throughout my PT school, doing all the extracurriculars. And then I would say my advice for someone who's contemplating whether to do an extracurricular or not during PT school, I would say 100% go for it. I'd say definitely stay curious. And I want you to think of it as you're networking, because you don't know who you're going to run into or meet. You don't know what you're going to learn from the opportunities that might come out of it. And when you're in PT school, I think what I was guilty too, you're constantly thinking about being the best PT you can be, and you're learning about the psychomotor, like hands-on skills, but we almost forget how to almost forget the side that we still want to be able to develop ourselves. Like personal development is important too. So doing these extracurriculars would help with that. I actually started PT school before the pandemic and graduated and started practicing as a PT during the pandemic. And then during that time, unfortunately, it's always been a problem, but it brought more attention to the fact that we are seeing ageism, racial inequalities, and health disparities bring to light in healthcare. And I hope these issues are talked about in PT school education in all schools, and PTs to become better advocates for our patients who are underrepresented, so we can see healthcare and PT to have a more equitable future. So in terms of career path, I'm not exactly sure where I want to be like right after residency, because I'm still debating whether if I want to be in a setting like outpatient neuro and inpatient rehab, because those are my two favorite rotations and settings I like being in so far. But at least what I want to impact is I want there to be more focus in geriatric care for primary prevention and fall prevention, and having become normal for geriatric patients to be able to go to PT for annual visit, like a doctor's visit annually. And also being able to encourage older adults to live more independently, stay in the home for a longer period of time, and be able to do what they love to do. In terms of what I want to advance the care in both Japan and the United States is the ones that I just mentioned. And I'm not exactly sure, but I still need to learn like the medical terminology in Japanese. So hopefully I can get my license in the country of Japan. So those are my goals right now, but nothing concrete yet. It's definitely an honor to be a part of this group. I think it gives me an opportunity to be able to connect to and reach out to underrepresented PTs and also student PTs, and being able to encourage them to go through specialization training and continue to build a group so we can learn and mentor from each other. It's important because when you see our patient population, they are more diverse than the healthcare like provider diversity, and it's best to have people that you can connect with and also have. So let me rephrase it. I think it's best to have people that you could have a connection with, and also be able to have them to be able to be understood culturally. And the other side too, I think having a more diverse workforce, it would allow others to, in the facility, in the clinic that you're in, your coworkers, to be able to learn about different cultures and be able to recognize inequalities and disparities, even though you might not be an underrepresented individual.